Hey there, it's Moy, and today we're delving into the captivating realm of anatomy and massage, spotlighting the remarkable longissimus thoracis muscle. As a vital part of the Erector Spinae group, the longissimus thoracis plays a crucial role in maintaining posture and facilitating movement. Originating from the various points including the lumbar vertebrae, sacrum, and iliac crest, it inserts into the thoracic vertebrae and ribs, forming a sturdy support structure for the spine. This muscle not only keeps the thoracic and lumbar regions upright, but also aids in lateral spinal flexion as it contracts unilaterally. While there are three types of longissimus muscles, today we're focusing on the thoracic variant due to its accessibility. Stay tuned as we explore effective massage techniques to ease tension and promote relaxation in this essential muscle group. Before we get into deeper strokes, as always, it's crucial to properly warm up the longissimus thoracis. This muscle can vary in depth, being more superficial in some areas than others. Visualize the longissimus as a cylindrical tube running alongside the spine, making it super easy to palpate. For many patients experiencing thoracic tension or SI discomfort, addressing the longissimus is a solid starting point. So let's ensure we thoroughly warm up this muscle before proceeding with those deeper strokes. To start, let's get some extra attention to the you know what? I'm just gonna let Google say it.
Thoracolumbar aponeurosis,
which is often overlooked when treating the longissimus. Using both thumbs will work along the lower half of the erectors in a circular or alternating pattern. Pay close attention to the area on and around the SI joints. I prefer to move quickly here to stimulate warmth and encourage circulation in the fascia. Now, let's transition to some cross fiber directly on the sacrum. This area holds a significant amount of fascia and ligaments that are often overlooked. Using the pads of your fingers, not the tips, move quickly across the entire sacrum. It's crucial to remember that the sacrum is part of the spine and has a number of muscular attachments. By using the pads of the fingers, we ensure we're not poking or stabbing any bony landmarks. Many therapists encounter challenges when it comes to achieving depth in their massages. It's not due to lack of strength, but rather a question of efficacy. Finding the techniques that best suit the style and physical mechanics. To start, position your fingers gently against the lower back, right against the ilium. Bend your fingers slightly to increase depth, making sure to engage the muscles of the hand rather than straining the structures. The strength should be derived from the weight of the other arm and body. Now, let's introduce some cross fiber techniques. Utilize your fingertips to strum the longissimus, akin to playing power strokes on the guitar to the tune of Beverly Hills by Weezer. Just kidding, don't do that. Or you know what, do whatever you want. This motion adds a subtle rocking movement to the body, enhancing the overall experience and including some different variations. Finally, conclude your strokes with targeting the muscles between the scapula and the spine. Let's delve into some stripping techniques, but before we begin, it's crucial to review some proper hand mechanics. Before applying any pressure, it's essential to locate the lamina between the spinous process and the longissimus muscle. Many practitioners tend to exert pressure using the most medial part of the thumb, forming almost like an L shape. However, this places undue strain on the MCP joint of the thumb and lacks power in the stroke. To execute it effectively, supinate the arms so the thumbs are parallel. Position the table so the arms are fully extended. Gently bend your thumbs for added depth. Run your thumbs along the entire length of the lamina, reaching the sacrum. Transition to the pads of the fingers to navigate over bony landmarks. Conclude with some circular movements using the thumbs on the SI joints. Gradually work your way up the longissimus muscle. Repeat the process as needed. Now, let's move on to the double fist techniques down the longissimus muscle. Your primary knuckles will be those of the pointer finger and the middle finger. The pointer finger knuckle should be the one positioned in the lamina closest to the spine. Imagine a slight twisting or supination of the arm to ensure proper alignment of your body. Cross your thumbs for stability, creating an anchor to each other. Make sure you stack your joints and body directly over the fists. Run your fists down the entire length of the erector muscles. Once you reach the ilium, roll the fist one knuckle at a time towards the base of the palm. Make your way back gracefully and repeat. It's crucial to lower the table as much as necessary to apply effective pressure. Move slowly and regularly check in with the patient regarding pressure. Now, let's move on to the next technique. In the scoop and soothe method, imagine your thumbs as shovels. Position them in the lamina and pronate your arms so your thumbs are parallel. Delicately dig down and scoop up, being cautious not to apply excessive pressure under the rib cage. I prefer to glide along the spine until the longissimus muscles feel less distinct. Given the strain this technique can place on your thumbs, utilize a massage tool with a similar principle is advisable. Just like your thumbs, scoop and soothe with the tool. I find it beneficial to place a finger slightly ahead of the tool to gauge proximity to the ribs. As you move away from the apex of the longissimus, gradually reduce the pressure for smoother experience. This approach ensures an effective and yet deep, delicate work. For the final and most common technique involving the elbow, therapists often apply pressure at the olecranon, which creates a small area of contact. However, considering the longissimus muscular tubular shape, it's easy to slide off and on with the elbow. Many therapists lack confidence in applying deep pressure due to concerns about hitting the spine or ribs. To address this, aim to place the pressure about 1 inch below the elbow, allowing for a broader contact area. Begin at the low back, locating the origin with the fingertips before transitioning into the palm and lastly the elbow. Start with around 50% pressure and gradually increase it, adding roughly about 5% at a time. Position your hand towards the ear at a 45-degree angle to maintain a broad contact point. If you encounter resistance or a dry spot, gently twist to maneuver yourself out and continue with the stroke. The approach can vary based on therapist preference and needs. Personally, I prefer to work from top to bottom at times, employing the same principles throughout. The key difference lies in positioning the hand on the elbow towards the hip, ensuring that consistent 45-degree broad contact angle. One important tip is to avoid applying too much pressure on the hand responsible for maintaining balance on the table. Doing so can absorb a significant portion of the pressure intended for the massage. By being mindful of this balance, you can optimize the effectiveness of the technique while minimizing strain on your body. For those of you who stayed until the end, here's an additional technique I like to begin with. Knowing that this patient reports mid-low back stiffness, I typically start with a myofascial release over the
thoracolumbar aponeurosis.
To initiate the technique, I first place a towel on the intended area, which can provide a better grip on the skin. Then I create a twisting pattern with one hand pushing down while the other hand is pushing upward. I hold this position for about 30 seconds or so, allowing for an effective myofascial release. Thank you for tuning in today. I hope you gained some valuable insights from this video. If you found it helpful, please consider subscribing and hitting the like button. Remember, my goal isn't to dictate how you should massage, but rather to demonstrate techniques that work for me. It's about fostering a conversation about massage and including perspectives from around the world. Always prioritize customizing each session to meet your patient's unique needs. Bodies and preferences can change over time, so adaptability is key. Sending you all lots of love and good vibes. Until next time, peace out.